Good evening. My name's Tim Morey, and I have the privilege of leading the Department of Anesthesiology here at the University of Florida in Gainesville, Florida. This department is in its 63rd year of existence. We've been graduating residents for over 6 decades, starting with Haven Perkins, who was our very first resident, until we graduated 22 residents last year. They go on to fellowships as well as practices around the United States and the world in academic medicine, in private practice, and also in the armed forces. At Shands Hospital, we anesthetize about 55,000 patients a year, not including the work that we do in the intensive care units and also in the pain medicine clinics too. The operating rooms and the cases that we do are sort of typical of what you would expect in a big major university hospital. They include general surgery, plastic surgery, orthopedic surgery, neurological surgery, heart, lung, burn, pediatrics, gynecology, and so on. We also have some specialty services in solid organ transplantation, level 1 trauma injuries, and high-risk obstetrics for women from around the state of Florida who have very complicated pregnancies. The facilities here are wonderful. I think that you'll like them. We've been building and growing as the state continues to add population. Our newest location is the Heart Hospital and also the Neurological Hospital as we opened up 3 years ago. We also have a trauma center and a cancer center that we opened up in 2011 and are renovating the old university hospital that was opened up in 1985. Outside the main complex, we have a surgical center, both for adults and one for children, that was opened up a few years ago. And our newest addition, we opened up last month actually, was a surgical center located in the old Sears Center at our local mall. Here at the University of Florida, I think you'll find that you'll get a complete and comprehensive education about every aspect of anesthesia, not only operative anesthesia, but we also are present in 9 of the intensive care units that are run here in the hospital. Those include general, trauma, neurological, cardiac, vascular, pediatric, burn, and others too. We're still a big growing university. We have a thriving department here in the clinical arena, but not only clinical and education, but also research. We honor research. We have this culture of inquiry and scholarship. And if that's something that you want to participate in, we'd be very glad to have you here. Outside the university, I think many of the residents are friends. They have a very active social life with one another. They enjoy spending time with one another, not only at restaurants, but also outside at the many parks and other features like beaches that we have here. I talked with one of them yesterday when I was working and asked them, why did you come here? And they liked the clinical enterprise, but the other thing that they liked was the excellent healthcare benefit for the residents and for having kids, and also the opportunity to do some moonlighting too. So I hope you'll consider coming to visit us. One thing I can promise you is we'll have no snow and we'll get 270 days of sunshine a year. So thanks for being with us, and hope to see you in March.